Well, emergency medicine is one of the specialties that gives you a huge range of clinical skills, and you can deal from the minor to the major incidences. For example, last week we had a lady who came in who had abdominal pain. We used the ultrasound machine. We found that she had a aortic aneurysm. She didn't want treatment, and my colleague, my registrar, decided to talk to her, and he found that she was depressed. And after lots of talks to her and her family, she actually agreed to have treatment. So there's a lady who, at 91, could be dead, but actually through not just clinical skills, but actually empathic skills, where emergency medicine allows you to do so, we've actually changed her life around. And actually that was a really good example for us. A few years back we had an M4 bus crash which came here, and the passengers were brought here, and I often use that as an example because we had the occupants were Polish, so none of us could speak Polish. There was a mother and children with limbs torn off, and it was heartrending. You know, the floors were covered in blood. You know, our cleaners couldn't mop fast enough, and it was a fantastic example of teamwork where the cleaners, the nurses, the radiographers, the doctors, we all mucked in together. And that's the beauty about emergency medicine. It's about teamwork, leadership skills. It's about sharing responsibility. I think it's important to try and to do 4 months in a post, because it might suit you, but you're not going to know unless you actually try it for yourself. The pay is the same as all the other medicine jobs. You would start as FY2 on 30-something. You start on as a consultant on 70-something. The work is a service delivery job. So we have patients, our doors are open 24/7, all the time. So constant work. It's fantastic at the moment. It's a buyer's market because emergency medicine has expanded. We've A&E are being used 24/7. We've had over 1 million patients seen, 30% increase year in. So we need doctors, and we want doctors who are dedicated, who are enthusiastic, who actually want to be a jack of all trade. I actually changed from orthopedics to emergency medicine, and that change for me is the right thing.